మేడం మేడం ఇక్కడ మీకు ఈరోజు హర్ష తొందరగా వచ్చిందండి. సో వెళ్తా Good morning to all dear participants. Today's topic healing without the knife lifestyle solution for surgical risks. Today Dr. Raghu sir with us to discuss about topic. Dr. Raghu sir, please take the session.
So, thank you so much. Today's topic is healing without the knife, lifestyle solutions for surgical risks. So, the main concept behind this webinar is like most of the surgical problems or pathologies are related to lifestyle. If we deal the pathologies or problems in the early phase itself, like whenever there is like inflammation, if we deal that problem, if we correct our lifestyle, there are high chances that we may not need to go to surgery. So, what are all the problems that we can correct with lifestyle changes? Is one, gallstones, piles, even fatty liver, PCOD. So, even carcinoma, rectum, colorectal cancers, all these are related to lifestyle. So now the epidemic is, so we know a lot of epidemics, pandemics, okay, like COVID, we know. But now the main epidemic or pandemic type of situation is related to lifestyle. Lifestyle diseases turning surgical. Most of the hemorrhoids or fistulas, pilonidal sinus, all related to proctology, anorectal pathologies we face in clinical practice are due to lifestyle problems. So, poor lifestyle, what happens? The pathology here is due to poor lifestyle, there will be inflammation. This inflammation leads to organ dysfunction, which again we need to plan for surgery. So, this is a sequence of events which happens due to poor lifestyle. So, lifestyle factors like constipation, low fiber diet, sedentary lifestyle, obesity, chronic stress, poor sleep, high sugar drinks, diets, fatty foods, poor hydration. All these are leading to surgical problems like fissures, piles, fistula, gallstones, hernia, ulcers, IBS, GERD, fatty liver, pancreatitis, kidney stones. So you can see all these are surgical issues. People are undergoing surgeries for these. But if we deal with such type of issues in the initial or early phases, we can prevent lot of surgeries. The science behind healing without the knife is the body has intrinsic healing intelligence. So body has this type of intelligence that it heals on itself. Every disease passes through reversible stages before surgery is needed. So lifestyle correction can reverse early stages. So this inflammation leading to fibrosis, structural damage, then leading to surgery. So when we tackle the situation here at the inflammation phase or at the fibrosis phase, we can prevent structural damage and surgery. So lifestyle modification can stop progression at inflammation and fibrosis stages. So we offer lifestyle management sessions or programs at Honest Robotic Hospitals. Not only surgeries, but we have these programs like correction of lifestyle so that we can prevent lot of surgeries. So this is we know there is a connection between gut and brain, mind gut hormone connection. The gut is called the second brain. So 90% of serotonin is secreted from the gut. So emotional stress affects physical healing. What happens due to this that inflammation and all is the gut permeability weakens. This weakened gut permeability leads to leakage of toxins from the gut. So these toxins enter into the liver, leading to fatty liver or CLD, such type of issues. So five major lifestyle factors that lead to surgical conditions. One, wrong food timing. Second is toxic diets like processed foods, fried foods, sugary foods. Third is sedentary living, weak abdominal wall and poor circulation. Fourth is stress and sleep disturbance, which is leading to hormonal dysregulation. Then toxin overload, which leads to gut biases or fatty liver or skin issues. Most of the people have acne and fatty liver. Regularly, we see this type of cases in our clinical practice. So they think that there is some issue with their skin, but the issue is with not skin or liver. It is with gut. So due to leaky gut, the toxins leak and they enter the bloodstream. This bloodstream will supply the entire body. That toxins will create acne or any type of skin issues. So that is mainly due to gut inflammation. So lifestyle medicine, the non-surgical treatment model is here. We treat like this. First, we'll correct the nutrition and bowel rhythm. So there will be difference in movement of bowel. Some people will pass stool twice a day, thrice a day. Some four times a day. Some will not pass stool, like they'll have constipation. So we will correct that bowel rhythm with nutrition first. Then we clean your liver and gut. That is a detox protocol. Then we calm your nervous system, stress management. Then followed by condition. We condition your body through yoga and core strengthening. So this is a treatment model we prefer for a lifestyle modification of gut dysbiosis. So we have treated many such patients without surgery uh, in initial grades like grade 1 or 2 fissures, hemorrhoids, fistulas, and even grade 3 as well. So through lifestyle changes, it can be possible. So foods that heal versus foods that harm. Healing foods are fermented, fiber-rich, antioxidant foods, and proper hydration. People not prefer antioxidants, fiber, and fermented foods in their diet. Fermented and antioxidant foods are much more important, and these are the harmful foods: fried foods, refined, red meat, carbonated drinks. All these are harmful foods. So we should prefer green veggies, which are green because it has chlorophyll, it has magnesium, which indirectly has its effect on the gut. So the role of emotions and stress. Emotional constipation leads to physical constipation. So definitely stress and emotions has its own role because of cortisol. So lifestyle prescription, what we do is mindfulness before meals, laughter and sunlight therapy, deep breathing and sleep hygiene. So these are the practices we offer them. Then this is the 5R formula to avoid surgery, any type of surgery, like recognize early warning signs. If you have any problem, any warning signs like bleeding per rectum or indigestion issues or initial grade 1 fatty liver, you recognize them. And repair gut and liver. Repairing of gut and liver is much more important. Then rebuild your hormones and metabolism. Then reprogram your habits. Then reverse inflammation. So before the surgeon removes the organ, remove the cause. So this is a 5R formula to avoid a surgery. Then case studies from knife to natural healing. Gallbladder patient reversed symptoms with detox, piles and fissure healed. So these are the some types of infections or pathologies we reversed with lifestyle. When surgery is still the best option. So people think that for every pathology or problem, we need to solve it without surgery. That will not work all the time. So there are highly advanced equipments or procedures available, like robotics, laser. like robotics, laser, and laparoscopy, which are minimally invasive. So even if they are willing for like people need to understand that for every problem, it will not be solved with lifestyle issues. It depends on the grades, grade 1 or grade 2. Okay, so laser and laparoscopic surgery is much more important when waiting is riskier than operating, and surgery plus lifestyle leads to total healing. So surgery removes the disease, lifestyle removes the cause. So remember this. So the future surgical prevention clinics we are planning, lifestyle OPD clinics from honest robotic hospitals. So take home message is every disease begins with lifestyle, not pathology. Prevention is smarter than incision. Heal from within before the knife steps in. So healing without the knife is not anti-surgery. So this people need to understand that lifestyle factors or healing will not help all the time. Sometimes you may need surgery. So that's all. This is how this the main motto of this webinar is like lot of the surgical issues are due to lifestyle issues. So we can correct those surgeries, we can prevent those surgeries by maintaining proper lifestyle. Thank you so much.
Thank you so much, sir.
Thank you.